Hey guys, so I am going to be talking about galactosemia, and if you pull up my PowerPoint, you can easily follow along. I just wasn't sure how to get it pulled up where y'all could actually see it, but you can follow along really easily. So I'm going to be talking about galactosemia. This is a disease, well, not really a disease, but um, something these patients are born without a certain gene, and normally you see it early in childhood. So normally it's infants, and it can be seen into adulthood. But at that point, you're seeing the devastation of the disease. So it was actually first clinically seen in 1908. It is an autosomal recessive metabolic disorder that affects how the body processes a simple sugar called galactose. So galactose actually comes from lactose, and lactose is broken down into glucose and galactose. And those are found in dairy products and baby formula, but not soy. Okay, and then moving on into the pathophysiology. So galactose is an energy source for infants and is important in early development. After ingestion of lactose, it is broken down into glucose and galactose, like we had already talked about it. I'm on the third slide of my PowerPoint at this point, but if you're looking at the pathways, there are actually three pathways, with the main pathway being the LALOR, which is center right, middle right. And sorry, there are three other pathways, and those are the accessory pathways. And it kind of talks about how it's broken down into galactose. Okay, so signs and symptoms of galactose in the untreated infant would be, if you look at my picture, the big things are brain damage, cataracts, jaundice, enlarged liver, and kidney damage. But a few more of those would be actually liver failure, lethargy, bleeding, E. coli infection or sepsis, feeding problems, and all this resulting in failure to thrive. We'll get to our treatment in a little bit, but pretty much this can be diagnosed within the first 10 days, and we'll talk about more of that in a minute. But the only cure for it, and not even a cure, is a lactose-free diet. It has to be established immediately. In the untreated adult, you could see reproductive organ abnormalities, neural and renal derangements, bone health concerns, speech impediments, cognitive impairment, liver cirrhosis, cataracts, and then the list goes on. So it's pretty detrimental if you don't get it controlled in that early childhood stage. So the diagnosis and testing. So and as far as like newborn testing, which we'll talk about, it's like a newborn screening, and normally galactose may be in the panel, but you may need to check and ask if you have a feeling that your child could have this, which doesn't happen very often, but it's always something to think about. But the two big things are the detection of increased erythrocyte galactose 1 phosphate, and it's normally higher than 10 milligrams per deciliter, or decreased or absent GALT enzyme, which is galactose 1 phosphate uridylyltransferase. So that's like the typical screening. So the treatment, like we talked about, is a galactose restricted diet. So milk products can be replaced with lactose-free formula. We talked about bone health earlier, so recommended vitamin D and calcium. These children are at an increased risk of signs and symptoms that can affect them into later adulthood, because the lactose diet is not sufficient in preventing these symptoms. So unfortunately, that's how it is. So avoid breast milk, infant formulas containing lactose, cow's milk, all dairy, whey-containing foods, and medications that contain lactose or galactose. And then anesthetic implications, just really quick, and then we'll go into the questions. But elevated clotting time, so you're prone for bleeding. Albuminuria in this population can cause osmotic diuresis, so urine volume can be an unreliable measure of volume status. They're susceptible to infection. We talked about that earlier, especially E. coli, so make sure you maintain an aseptic technique. Avoid hepatotoxic volatile anesthetics, mainly halothane, and then drugs that are metabolized by the liver, so pancuronium, thiopentol, opioids. And then hypotension during surgery can cause further hepatic and renal damage as well. So be careful of that. And then if you look in my notes, you will see the answers to my questions. I'm not going to go over those, but my references are at the end. So thanks. And now I'm trying to end my stream.